multiple myeloma is a disorder of the plasma cells with patients who've exposed all three classes of therapies have overall response rate of less than 12 months. So we actually need new advances in therapies where we can give patients a one-time treatment of CAR-T therapy where we can cause durable and deep responses. So CARTITUDE-1 is a phase 1b and phase 2 portion of J&J 4528, which is looking at relapsed refractory multiple myeloma patients. So the J&J 4528 is a structurally distinct second-generation chimeric antigen T-cell therapy with two BCMA binding domains. The phase 1b portion of the CARTITUDE study showed that it's looking at patient safety and confirming the recommended phase 2 dose as informed by the LEGEND-2 study, and the phase 2 portion of the study would look at efficacy. If you look at the patients that were treated on the phase 1b portion of the study, there were 29 patients that were enrolled with a median age of 60, and half of these patients were female. All patients were heavily pretreated as their median prior lines of therapy was 5, and it could range up to 18. These patients were all 100% triple exposed, with 86% being triple refractory, and 72% of the patients were penta exposed, with 31% of the patients being penta refractory. When we look at the safety data, we can see the most common grade 3 or 4 adverse event was hematological, with non-hematological adverse events of grade 3 or 4 being very uncommon. 2 patients had a lab abnormality of increased AST, 1 patient had a lab abnormality of increased ALT, and 1 patient had diarrhea. All but 2 patients had cytokine release syndrome, with 86% of the patients having mostly grade 1 and 2 CRS, with only 1 patient having a grade 3 CRS event and 1 patient having a dose-limiting toxicity of grade 4 CRS, which the patient passed from complications at day 99. Neurotoxicity was very uncommon in this study, as only 10% of the patients had any grade of neurotoxicity. 1 patient had a grade 3 neurotoxic event, which actually happened concurrently with her grade 3 CRS event, both of which resolved very quickly within a day after the administration of tocilizumab and steroids. In terms of its efficacy, 100% of the patients had a response, a reduction in their paraprotein. That means every single patient responded. We had a 100% overall response rate, and if you break that down further, 69% of the patients were actually in CR or better, and 86% of the patients were in VGPR or better. Of the 29 patients, 27 patients are still in progression-free survival at a median of 6 months follow-up. We had 17 patients that were evaluable for MRD status, and all 17 patients were MRD negative at the time of latest assessment. Overall, in conclusion, I would say that the CARTITUDE-1 study, the phase 1b portion, confirmed the recommended phase 2 dose. We also showed that J&J 4528 was very safe and had a manageable safety profile.